Hello people, look at this question here. Mention 4 classes of antihypertensive drugs. They're asking about what? Antihypertensive drugs. 4 classes you have to give with one example each. What is the drug of choice in diabetic hypertensive patients? So if a patient has both diabetes mellitus and hypertension, what is the drug of choice and why also? You have to explain all this just for 3 marks. So let's get there quickly. So let us say this one, antihypertension classification. 4 classifications we have to write, guys. So let us choose the first thing to write. The first thing to write will be ACE inhibitors. In ACE, enalapril, ramipril. You can give others also, captopril, lisinopril, perindopril, ramipril. Any one of these you can give. Okay. It is angiotensin converting enzyme inhibitor. Okay, it is coming under this renin-angiotensin system inhibitor. 1 is done, guys. Now let's go to 2. The second thing you will mention is angiotensin receptor blocker. You have to write full form, okay? Don't write short form at all. ARB, angiotensin receptor blocker. Okay, in that what will you say? It is telmisartan. Okay, telmisartan you will usually give 20 mg like that. Okay, telmisartan. Okay. Second class is done. Third one, let's go. Third one, we will talk about thiazides. Thiazides, you can talk about diuretic. Sorry, that is hydrochlorothiazide. Okay, talk about hydrochlorothiazide. Then, so we are done with 3, right? 3 we are done with, right? I'm thinking 3 we are done with. So we are done with 3, right? 1 is this one, ACE, 2, 3. We are done. Now, fourth one, you go for calcium channel blocker. Okay, we're just scrolling down here. Calcium channel blocker, you say this is the one that you want to know. And in that, which one is very important? Amlodipine. Okay, we learn amlodipine. This is the fourth one. Then coming to fifth one, they have asked only 4 classification. Then this is enough. Okay, what and all will you say? Very important ones you should say: ACE inhibitors, ARBs, thiazides, and calcium channel blockers. Anything else you want to learn, you can learn. Okay, now let us go to the second part of the question. So what was the second part of the question, guys? What is the drug of choice in diabetic hypertensive patient and why? So if the patient has diabetes and hypertension, then how will you treat? Okay. So if the person has diabetes and hypertension, the drug of choice is actually ACE inhibitor. You will write ACE. Okay. ACE inhibitors are the drug of choice. Okay. They'll protect the kidney and all that. But if the person has cough and if you're fearing that they will get cough, you can use ARB. But for exam's sake, you have to write ACE, that is angiotensin converting enzyme inhibitor. Okay. The examples are captopril, enalapril, lisinopril, perindopril, ramipril. Okay. So look at what textbook says: angiotensin converting enzyme inhibitors. Okay. So this is the first choice of drugs in all grades of essential as well as renal vascular hypertension. Okay. Most people, this is the drug of choice. Which one? ACE. ACE inhibitor. Don't forget that inhibitor word. Okay. ACE inhibitor. Okay. So what they are saying here, if you have anybody who has diabetes, okay, you can protect the kidney of these diabetics by giving ACE inhibitors, because these ACE inhibitors, they improve the blood flow to these kidneys. Who is improving blood flow to the kidney? ACE inhibitor. Okay, so the blood flow to the kidney is improving. Okay, so kidney is happy. So that is why they are saying that it is the most appropriate antihypertensive in patient who have diabetes or any other patient who has nephropathy, which is not because of diabetes, but they have nephropathy. If they have anything to do with heart also, left ventricular hypertrophy. Let's show you what left ventricular hypertrophy is. Okay, so this is our heart and this is the left ventricle. The left ventricle has become hypertrophied. Okay. So in this case also, then you can give this ACE inhibitor. They are saying if the patient has angina, chest pain, if they have post myocardial infarction, okay, that is post heart attack patients, CHF, that is congestive heart failure, is it? Okay, all these people know it is best to give ACE inhibitor. It will improve the blood circulation to the kidney. But what about the heart? What does it do to the heart? It will regress the left ventricular hypertrophy. Okay, whatever has become so much, it can regress. Regress means it can go backwards, right? Okay, but remember one side effect is there, that is dry persistent cough. You should always see if the patient develops cough after giving this ACE inhibitors, you should discontinue this, and then what will you shift to? ARB. Very good, very good. You know what is good, guys? Good is that they're asking questions in the recent exams which are more practical and daily use kind of thing. I like this question. Bye bye.